At the time of this recording, health officials are investigating a growing wave of Cyclospora infections across the United States. The CDC reported 843 confirmed domestically acquired cases in 31 states as of July 9, 2026, with 86 hospitalizations and no reported deaths. Officials have also warned that the number may continue to rise because many cases take weeks to be reported, tested, and confirmed. More than 1,500 additional reports still required further analysis when the CDC published its latest update. However, there is one important distinction you need to understand. These 843 cases do not necessarily represent one single outbreak caused by one food. The total includes several clusters under investigation, along with cases that have not yet been connected to a common source. The FDA has listed several active Cyclospora investigations, but the specific foods involved have not yet been identified. That means this is not a time for panic. It is a time to understand the symptoms, handle food carefully, and know when to contact your doctor. Cyclospora is not a virus, and it is not the kind of food poisoning that always disappears within 24 hours. It is a microscopic parasite called Cyclospora chitinensis. It infects the small intestine and is usually acquired by eating food or drinking water contaminated with the parasite. In the United States, previous outbreaks have been associated with different kinds of fresh produce, including herbs, leafy greens, berries, and vegetables. But because investigators have not identified the source of the current clusters, you should not assume that one particular food is responsible unless the CDC, FDA, or your local health department issues a formal warning. Let me give you a simple example. Imagine a 68-year-old woman named Margaret. She eats a salad at a family gathering and feels completely normal for several days. About a week later, she develops watery diarrhea, stomach cramps, bloating, and unusual fatigue. She assumes it is an ordinary stomach bug. The symptoms improve for 2 days, so she believes the illness is over. Then the diarrhea returns. That pattern, symptoms that appear to improve and then come back, is one reason Cyclospora infections can be overlooked. The most common symptom is watery diarrhea, sometimes accompanied by frequent or urgent bowel movements. Other symptoms may include loss of appetite, weight loss, stomach cramps, bloating, increased gas, nausea, and significant tiredness. Some people may also experience vomiting, body aches, headaches, a low-grade fever, or other flu-like symptoms. Symptoms usually begin about 1 week after exposure. However, they can appear as early as 2 days after infection or more than 2 weeks later. That delay can make it difficult to remember exactly what you ate and where you ate it. The illness can also last much longer than many common stomach infections. Without treatment, symptoms may continue for several days, several weeks, or even longer than a month. They may seem to disappear and then return again. That is why persistent or recurring diarrhea should not simply be ignored, especially if you are over 60 or take medicines for blood pressure, diabetes, heart disease, or kidney problems. Diarrhea does more than cause discomfort. It can make your body lose water and important electrolytes. For an older adult, that fluid loss may also affect blood pressure, balance, kidney function, and the safe use of certain medications. Watch for very dark urine, urinating much less than usual, a dry mouth, intense thirst, dizziness when standing, unusual weakness, confusion, or difficulty keeping fluids down. Seek urgent medical attention if you experience fainting, severe weakness, new confusion, blood in your stool, severe abdominal pain, or an inability to drink enough fluid to remain hydrated. If you develop watery diarrhea that lasts more than a few days, contact a healthcare professional. Tell them about any recent travel, restaurant meals, catered events, packaged salads, raw produce, or public health alerts in your area. Do not feel embarrassed about describing your symptoms clearly. Accurate details can help your doctor determine which tests are needed. Cyclospora can be difficult to diagnose because it may not be included in a routine stool test. Your healthcare provider may need to request a test specifically for Cyclospora. In some cases, more than one stool sample collected on different days may be needed to detect the parasite. This is an important point. A routine stool test that comes back negative does not always rule out Cyclospora if the laboratory was never asked to look for it. The recommended prescription treatment is an antibiotic combination called trimethoprim sulfamethoxazole, commonly known as TMP-SMX. But this medicine is not appropriate for everyone. Your clinician may need to review your allergies, kidney function, current prescriptions, and possible drug interactions before recommending treatment. Do not use leftover antibiotics. Do not take another person's prescription. And do not attempt to treat this parasite with random over-the-counter products. A healthcare professional should evaluate your symptoms, order appropriate testing, and decide which treatment is safe for you. Now let us talk about prevention. First, wash your hands thoroughly with soap and water before and after preparing fruits and vegetables. Wash fresh produce under running water before eating, cutting, or cooking it. Scrub firm produce, such as cucumbers and melons, with a clean produce brush. Cut away damaged or bruised areas, and refrigerate cut or peeled produce within 2 hours. However, there is an important limitation. Washing produce is still recommended, but it cannot be guaranteed to remove Cyclospora completely. The parasite may also resist some routine chemical disinfection methods. In other words, washing reduces general food safety risks, but it cannot make a product named in an official recall safe to eat. If authorities identify and recall a specific product, the correct action is to follow the recall instructions rather than trying to wash the product more thoroughly. Second, prevent cross-contamination. Keep cutting boards, knives, countertops, refrigerator shelves, and your hands clean. Do not place washed produce on a surface that previously held unwashed produce or raw meat. Refrigerate perishable foods promptly and keep food preparation areas sanitary. Third, follow official health alerts instead of social media rumors. The investigation is changing, and case numbers may continue rising as delayed reports are processed. Check information from the CDC, FDA, and your state or local health department. If a product is eventually linked to the illnesses, pay attention to the exact brand, package size, lot number, expiration date, and distribution area. A photograph shared online may not contain enough information to determine whether your food is affected. Fourth, do not stop eating all fruits and vegetables out of fear. Fresh produce remains an important part of a healthy diet. The goal is informed caution, not panic. Continue following safe handling practices, purchase food from reputable stores, and respond quickly if officials announce a specific recall. There is another point that often causes confusion. Cyclospora is unlikely to spread directly from one person to another. After the parasite leaves the human body, it generally needs at least 1 to 2 weeks in the environment before it becomes infectious. Even so, anyone experiencing diarrhea should wash their hands carefully, avoid preparing food for other people, and clean bathroom surfaces properly. These actions also help protect the household from other infections that can spread more easily between people. Here is your practical safety plan. Today, check whether your state or local health department has issued an advisory. Wash your hands and produce carefully. Clean food preparation surfaces. Refrigerate cut produce promptly. Do not consume any product included in an official recall. If you develop persistent watery diarrhea, write down when your symptoms began, what you ate during the previous 2 weeks, where the food was purchased or served, and whether anyone else who ate with you became ill. Then contact your healthcare professional and mention Cyclospora specifically. Remember these 5 warning signs: diarrhea that continues or repeatedly returns, symptoms of dehydration, unexplained weight loss, severe fatigue, and symptoms that interfere with your ability to eat, drink, or take essential medications. If you are unsure whether your condition is becoming serious, contact your clinician rather than waiting until you are significantly weaker. The reassuring news is that Cyclospora is treatable, and most people recover. No deaths had been reported in the current domestic surveillance update as of July 9, 2026. But the investigations are continuing, the food sources have not yet been confirmed, and the numbers may change after this video is published. Always check the latest official updates rather than relying only on the figures mentioned here. Please share this video with a family member who might mistake prolonged or recurring diarrhea for an ordinary stomach bug. Subscribe.